Hello and welcome back to Dental Notes and Mnemonics. Today we'll be discussing Buccinator mechanism. So without any delay, let's get started with the video. First of all, before diving deep into the Buccinator mechanism, we should have a general idea about the Buccinator muscle. Buccinator muscle is a quadrilateral muscle. It develops from the second pharyngeal arch during the embryonic growth around 5th to 6th week of gestation. Buccinator muscle is supplied by the facial nerve, which is also derived from the second pharyngeal arch. Regarding the location of buccinator, then it is present deep inside the cheek. The buccinator muscle fiber originates from three areas, giving rise to three muscular bands. Two of the muscular bands have a bony origin. The maxillary bundle arises from the buccal portion of the maxillary alveolar process. The mandibular bundle originates from the buccal portion of the mandibular alveolar process. The longitudinal bundle emerges from the pterygomandibular rapha. The rapha connects the buccinator's posterior fibers to the superior constrictor muscles, the most superior pharyngeal constrictor. The fibers of all these three bundles run anteriorly and descend through the medullus, thus forming a musculature of the cheek. The buccinator muscle blends with the orbicularis oris muscle fibers. The maxillary bundle fibers blend with the orbicularis oris muscle fibers at the mandibular lip. The mandibular bundle fiber runs superiorly to maxillary lip. The longitudinal bundle fibers travel towards the oral commissure to insert into upper and lower lips. Laterally, the buccinator muscle is related to mandibular ramus, masseter and medial pterygoid muscle, buccal fat pad and buccopharyngeal fascia. Medially, the buccinator muscle is covered by cheek, submucosa and mucosa. The parotid duct, which is also known as Stenson's duct, pierces the buccinator muscle after crossing the masseter muscle. Then the duct takes medially at the buccinator's anterior border, opening into oral cavity into a small papilla opposite to maxillary second molar. Buccinator's sensory innervation comes from the long buccal nerve, which is a branch of maxillary division of trigeminal nerve, and motor innervation of the muscle is via the temporal and the cervical divisions of facial nerve. The buccinator muscle receives blood from the buccal, facial and posterior superior alveolar arteries, which form a rich anastomosis on the lateral surface and within the muscle fibers as well. The buccal artery is a branch of maxillary artery which supplies the posterior part of the muscle. Facial artery supplies the anterior, posterior and the inferior portions through its various branches, and posterior superior alveolar artery is the branch of maxillary artery, also contributes to its blood supply. The veins draining the buccinator muscles empty into pterygoid plexus and internal maxillary vein. Some mandibular lymph nodes drain the buccinator muscle. Let's discuss the functions of buccinator muscle. The buccinator muscle is the main muscle of the cheek. It helps the cheek to puff out, as in case of whistling or blowing a trumpet. So sometimes it is also referred to as trumpeter's muscle. The buccinator muscle sometimes also referred to as an accessory mastication muscle, as it coordinates with the orbicularis oris and superior constrictor muscle during swallowing, mastication, blowing and sucking. It also compresses the cheek inward against the molars, which helps the cheek to push food bolus towards the tongue. Buccinator muscle also maintain the cheek tension and preventing buccal mucosal injury. Play a role in the oral and pharyngeal phases of swallowing as well. Studies has revealed that the buccinator muscle help to regulate parotid secretion, having the small fibers inserted in the distal portion of the parotid duct. Buccinator is one of the first muscles to be activated by sucking during infancy. So now we will be discussing the buccinator mechanism. The buccinator mechanism refers to the dynamic balance between the buccinator muscle and the tongue that maintains the proper alignment and position of the teeth within the dental arches. We can understand the Buccinator mechanism more comprehensively when we integrate it with the functional matrix theory, which was proposed by Malvin Moss. This theory emphasizes the importance of functional influences on the development of the craniofacial structure. According to Moss, soft tissue functions, including the actions of muscles like Buccinator, they play a critical role in shaping the skeletal structure of the face, such as maxilla and mandible. Muscle, being a part of a muscle framework around the oral cavity, it plays a significant role in facial development. Functional stresses, which are generated by the buccinator, exert influence on the alveolar bone and contribute to overall morphology of maxilla and mandible. For example, when the forces are generated by the buccinator during the activities such as chewing, speaking, and swallowing, it can affect the alignment of teeth and the development of the jaw. In orthodontics, the Buccinator mechanism may be evaluated as a part of assessing how the external and the internal forces impact dental arch stability and facial growth. We break down this mechanism into simple form. Buccinator mechanism is like a tug of war between the tongue muscles and the circumoral muscles. We all know that tongue is very powerful muscles which equates the pressure exerted by the circumoral muscles. So there should be an equilibrium between the muscle forces from the external surface, which is due to the cheek muscles or the circumoral muscles, and the pressure which is exerted on the dentition due to tongue muscles. Take one more example. Suppose a plank is there. Two men are there who are standing opposite to each other and they are trying to move the plank with the equal forces, but the plank will not move. Similar to this condition, the Buccinator mechanism is counteracting the forces which is applied by the tongue from the internal surface of the oral cavity onto the dentition. As the balance is perfect, the development and the growth of the jaws and the dentition will be normal. Let's move what is the clinical significance of Buccinator muscle. Have you ever heard a patient complains about a loose or the uncomfortable dentures? Often the culprit is poor consideration of the Buccinator muscle during the denture design. The Buccinator muscle works to hold the denture in place during chewing and speaking. If the denture base extends too far in the buccal vestibule, the muscle will dislodge the denture. On the flip side, if the design is correct, the Buccinator provides natural retention and stability to the denture. This is especially important in the patient, those patients who are having the reduced alveolar ridges where the muscle forces play a very dominant role. The Buccinator muscle is very crucial while in planning for the reconstructive surgeries. After the oral cancer resections or the trauma, there is often a need to fill soft tissue defects in the oral cavity or the cheek. The Buccinator flap is commonly used in these cases. The Buccinator muscle, as we have already discussed, it provides a muscular pressure against the teeth and helps to maintain the shape and the alignment of dental arches, which is crucial in orthodontics. The imbalanced and dysfunction of Buccinator muscle can lead to misalignment or malocclusion. Buccinator can be a factor in overbite, underbite, or crossbite condition. If its forces are unbalanced, orthodontic treatment might be necessary to realign the dental arches. In orthodontics, the appliance therapy such as retainers or expanders are designed to counteract or balance the force exerted by the Buccinator to achieve proper alignment of teeth. Balance also plays an important role in the final retention of the treatment results obtained and to prevent the relapse of the treatment result achieved. Muscle also plays a role in development of facial structure. During growth and development, the forces generated by the Buccinator can influence the positioning of teeth and jaw. The muscle helps to shape the maxilla and the mandible by exerting pressure on the teeth and bone, which can have impact on facial symmetry. Assessing the muscle activity in children and adolescents help an orthodontist to predict the future growth patterns and the likelihood of developing certain malocclusions. Early diagnosis for the improper buccinator functions or unbalanced forces can allow for the preventive treatment, such as use of palatal expanders or early orthodontic treatment to guide the growth of the jaw and prevent more serious alignment issues later in the life. In case of the thumb sucking, the continuous sucking action leads to repetitive use of the orofacial muscles, including tongue, cheeks, and lips. Prolonged pressure from the thumb on the front teeth prevents proper occlusion, leading to an open bite. The pressure of the thumb on the maxillary arch may cause narrowing, resulting in the cross bites. The thumb pushes the upper front teeth outward while restraining the mandibular growth, altering the alignment. The hard palate may develop as a high arch or the V-shaped configuration due to upward pressure from the thumb. Also, during the orthodontic treatment, understanding the buccinator force dynamics help in planning the effective appliance design. For instance, in lip bumpers are used to reduce the buccinator pressure on the lower anterior teeth, promoting arch expansion in cases of crowding. Similarly, in patients with narrow arches, the buccinator forces need to be controlled to allow proper alignment and stabilization after the treatment. Oral screen is a functional appliance suitable for treatment of developing malocclusion associated with aberrant muscular pattern. The better muscle balance between the tongue and the buccinator mechanism can be established, and the re-establishment of the normal growth and the development can be achieved through this appliance. After the orthodontic treatment is finished, the buccinator continues to exert its habitual forces on the teeth. So, retainers are designed to counteract the muscular forces, ensuring that the teeth do not relapse into their pre-treatment positions. Now, let's have a quick review of clinical significance of buccinator muscle or the clinical conditions involving the buccinator muscle. The buccinator hyperactivity can excessively compress the underlying hard tissues, resulting in narrow arches and malocclusion. Facial nerve damage can lead to buccinator paralysis and difficult mastication. Loss of buccinator function can cause repetitive cheek mucosal lacerations as well. And as previously mentioned, abnormal attachment of this muscle may interfere with the proper prosthodontic management and oral hygiene maintenance. Abnormal buccinator attachments may also restrict cheek and lip movement, producing mastication and phonation difficulties. The tongue's outward force in the oral cavity balances the inward forces due to orbicularis oris and the buccinator contraction. Therefore, denture molding for a completely edentulous patient must be guided by muscle function. The buccinator, orbicularis oris, and pharyngeal constrictor form a functional unit. The buccinator mechanism essential to oral facial functions like swallowing, sucking, whistling, chewing, and vowel pronunciation. Food accumulates in the vestibule during chewing if the buccinator muscle is weakened or paralyzed. Buccinator muscle stabilizes the denture in several ways. First, it grips the denture's polished surface. Second, the longitudinal fibers hold the food bolus between the teeth during the mastication. And third is the buccinator's maxillary bundle raises the upper denture. Fourth, the muscle's mandibular bundle depresses the lower denture. Synkinesis is a condition arising from the nerve misfiring following an episode of facial weakness. Involuntary facial movements are triggered alongside the voluntary actions, producing symptoms like pain, eating difficulty, and poor cosmetics. Botulinum toxin treatment of buccinator can help to improve the facial synkinesis. Thank you for watching. This was all about buccinator mechanism, how it is playing an important role in the oral functions. If you found this content helpful, please like, share, and subscribe to the channel to stay updated with more topics like this. See you in the next video. Till then, bye bye. Take care. Have a nice day.